Well, the death toll from the coronavirus has now risen to almost 1,500 people, with at least 65,000 infections confirmed globally. On top of these growing totals, a World Health Organization advisor who's been tracking the virus's transmissibility in China has predicted that 2/3 of the world's population could end up catching the virus. Dr Peter Collignon is an infectious diseases physician and microbiologist at the Canberra Hospital. Currently, he's also the Executive Director of the ACT Pathology. He joins me now from our Canberra studios. Thank you very much for your time, Dr Collignon. I think it's important just to keep abreast of the development in relation to this disease. Let's start at the beginning. In relation to the announcement from the government yesterday that they would extend the travel ban, do you think that's a sound decision?
Well, at the moment, the virus is mainly in one area of China, in Hubei, and I would think while we've still got a chance that we may be able to control this virus and not have it spread around the world, keeping restrictions on to the places where there is the highest incidence of disease is not unreasonable. We won't really know whether it was the right decision for maybe even a couple of months. If we can contain this virus and we can make it disappear like the original SARS virus, which is very similar 15 years ago or more, well, then it was a right decision, even with the social and economic costs associated with it. So at the moment, I think trying to contain this virus and seeing if we could be able to not have it spread throughout the world is a good idea.
Look, I agree with you, and let's hope it ends up like SARS. I did look at those comments from the WHO official today, the World Health Organization official, who fears, just watching the way it's moved around in the Chinese population, that 2/3 of the world, it's reported, could become infected with coronavirus. How fair do you think that assessment is?
Well, I don't think that is a very likely outcome. I mean, that is on the assumption that every person who has coronavirus gives it to 2 or 3 other people. And then those 2 or 3 people give it to more. That's not what happened so far as we can tell. The real problem is we don't have enough data to know. What we do know is that where it's confined, and we have some idea of the cases. But the trouble is that's the tip of the iceberg, because for every one person that's diagnosed in hospital because they're very sick, there may well be 10 more people out of area. But if you look what's happened out of China, in Australia, the US and Singapore and in Europe, we haven't seen an epidemic outbreak so far. And even in that cruise ship that's anchored in Japan, yes, there's been about 5% of the people infected, but it's not 20, 30 or 60%, which that modelling would otherwise suggest. So at this stage, I think we at least have some hope that we may be able to contain this, slow it down. And also, if you look at other viruses that are more contagious than this one, for instance, the influenza virus, you look at swine flu. When that first started in Mexico, everybody was worried it had an 8% mortality, but very quickly in California, when it spread widely, you could see the mortality rate was much lower, as 1 in 10,000. Now, that did spread all around the world, but then again, 10 or 20% of the population got it, not 2/3 of the world's population. And that is a virus that spreads more than this one. And with SARS, yes, it spread to many countries. It spread to Canada, it spread to Vietnam, it spread to Hong Kong, and there were many deaths. It had about a 10% mortality. But at the end of the day, it was able to be contained, and as far as we're aware, it's not going from human to human anymore.
And how reliable do you think the Chinese government's information being passed through on this disease is?
Well, I think it's varied. It wasn't very reliable till the middle of January because I think there was, information not coming out. I actually suspect we're getting as much information as they've got available, but it's not perfect information. The definitions of disease are changing. I can't imagine they've tested huge parts of the population who have only had mild symptoms because they probably don't have the capacity to do it. In other provinces other than Hubei, they probably have, but it is interesting they haven't found huge numbers of cases relatively in those other provinces, and I think they would probably be able to be tested properly in those provinces. So at the moment, I think we're getting as good information as we can. We really won't know what's happening with this virus until we get a blood test that tells whether you've been exposed to it or not, what we call an antibody test. because that tells us if we take, say, 10,000 people and test them, well, 1%, 10%, 20% had it. Because we need that sort of data with an accurate test, which unfortunately isn't available yet, before we can know what proportion of the population has it. We also need more widely available what we call PCR or molecular tests, so we can test people with minimal or no symptoms or little symptoms to see, well, have you really got influenza or have you got somewhere else? Because even some of the people who have died out of China, they've actually had influenza and a bacterial infection rather than just the coronavirus by itself.
Well, last week I spoke with Dr Trevor Drew. Now, he's involved with the Animal Health Laboratories down in Geelong and a CSIRO project in order to look at vaccines, as I understand it, not antivirals. But he was talking about a 6-month time frame to go through all the testing and also human trials, etc. Is it still that long, do you think?
Well, I worry it might be longer than that. I mean, realistically, you've first of all got to, grow the virus you're going to put in the vaccine. You've got to put it and multiply it up. You've then got to test it in animals to check it's safe. Then you have to test it in people that check that it's safe and that it makes an antibody response. Then you've got to get a large sample of people, which I gather at the moment would be in China, where there is a lot of infection, so you can see that it actually works without causing too much harm. And then if we have to immunise, half the world's population, it will take quite a while before we have billions and billions of doses, particularly if you need more than one dose. So realistically, if you look at again what happened with swine flu, the vaccine wasn't available till after the epidemic had peaked, 9 months or 12 months later. This one I think is even harder than influenza virus vaccine, because at least we make that all the time. This is a completely new vaccine that we really haven't tried before, and I don't think it's going to be rolled out to a large proportion of the world's population if this problem keeps on going for under 12 months, and realistically it might even be 2 years.